So, hi everyone, my name's Wayne. I'm the founder of Tyrion. And Tyrion is a proof engine. I'll get into that in a second, but first, I want to introduce you to Blockchain Jesus. Blockchain is a broad term used to describe many different things. I'm sure you've heard over the course of the day. It's often pitched as a panacea for all sorts of technology problems. We have some infrastructure technology. We don't do everything. We do one very specific thing. We're a proof engine. We allow you to create a verifiable proof of any data file or business process. We do this by allowing you to anchor off-chain information to a Bitcoin transaction and get back a proof. You can use this proof to independently verify any piece of information without any trusted intermediary. So here's what Tyrion looks like. And the real problem that we're solving in the healthcare space is the problem of secure shared data. So we have all of these data silos, and I'm not convinced that we're anywhere close to eliminating them. But we have the challenge of having to send information from one party to another, and that other party being able to independently verify the integrity and the timestamp of that information was initially created without having to rely on a trusted intermediary. So this problem is pretty broad across electronic health records, IoT, medical device data, all of the information that's part of the cycle in healthcare. Let me skip this. So this is how our technology works. Somebody sends us, we're a software API, somebody sends us some information, we anchor that to the blockchain, and we deliver back what's called a blockchain receipt. This is a piece of JSON data that you can store in your own database, and you can share with other parties that they can use to verify something. This is what one of those proofs looks like. You see it's just a simple code snippet. And our technology allows you to enhance your existing apps. So you stay in control of your data, and it's very easy to use our technology. So just yesterday, they had the Distributed Health Hackathon, and 13 out of the 18 teams used our technology as a basis of their entry. And all of the winners actually used Tyrion as well, so I was really, really psyched about that. The underlying protocol that we've developed for anchoring data in the blockchain is called Chainpoint. And we've been very fortunate. We've had lots of adoption. Some of the companies that are presenting today are using the Chainpoint protocol inside their technology. Some of our competitors have started adopting Chainpoint. And in the couple weeks past, the WC3, which is a web standards group, identified and made up some public announcements about Chainpoint as being one of the most promising blockchain technologies, and they fast-tracked it towards their internal standards process, and we formed a community group around that. So, how are people using our technology? Well, it really started off with us having a relationship with Philips. I won a hackathon back in September of 2015 by making an insurance claims processing system that utilized Tyrion to create a verifiable audit trail. And a few weeks later, I got a phone call from a guy named Bart, and he said, "Hi, my name's Bart. I'm from Philips. I'm trying to use Tyrion to collect data from MRI machines, and I have some questions." And after my jaw got off the floor, we started talking, and that was the start of a relationship that we had. And over the course of the year, we've done a whole series of proofs of concept. What we did initially was use Tyrion to collect data from industrial medical equipment to create an audit trail for its maintenance, usage, and calibration history. And after that, we did another proof of concept where we automated a healthcare-related business process that spanned multiple IT systems, and we were able to create an audit trail that was useful for medical reimbursement and regulatory purposes. So let me switch here. I'm going to show a video that Philips made of another use case that used our technology, and then after the video is finished, I'm going to go ahead and explain how Tyrion was used.
Blockchain, enabling better healthcare research. An increasing group of consumers are tracking their lifestyle, their activity, or their diet, generating an increasing amount of valuable data. Now, what if researchers could access this data on demand to help the industry advance preventive and personalized healthcare? What if consumers could share their personal data without compromising their freedom and privacy? Thanks to blockchain, it is now possible. In this concept of a data marketplace, it enables quick and secure matching of siloed data from individuals with researchers' needs. Meet Akio, a 33-year-old dad with an active lifestyle. Like many people, he has been tracking his activities, enriching his data set every day. He uses a dashboard app to get an integrated overview of all his data. Through the app, Akio can join the data marketplace. Now meet Mirai, a health researcher. For her research, she requires a specific data set. She submits the research and sample criteria into the data marketplace. Based on the type, quality, and volume of data, she gets a quote on how much it will cost. Since she can access data directly from users, the cost of her study is much lower than if she would have to hire clinical research participants via an agency. The marketplace matching engine searches for eligible data sets. Akio is one of them. He receives a notification requesting his participation in the study. Akio is positive about the research goals and decides to give consent for the use of his data in the study. Once all Mirai's criteria have been met, she can start the process of data analysis. At this time, Akio is rewarded for his participation. Data analysis is done locally, without disclosing the actual data, thus ensuring the participants' privacy. If required, it's possible to save a snapshot of anonymized data in a temporary secure health vault using blockchain to manage access. After the research is done and peer-reviewed, the vault can be destroyed and the data will no longer be available. Thanks to the data marketplace, Mirai has successfully completed her research. By using our blockchain-powered solution, Mirai was able to access existing rich data sets in an efficient and responsible way. Blockchain, enabling better healthcare research. Innovation and you. Phillips.
So let's talk about how Tyrion's technology was used inside this. So there was part of the demo where they talked about collecting data from IoT devices as part of this marketplace. So they used they wanted to use code that was running, encrypted code running inside a trusted environment, and they used Tyrion to verify the encrypting code's integrity before execution. There was also part of the video where you noticed that the actor gave consent for participation in this. Tyrion was used to generate a proof to verify that consent was given, and then all the integrity of all the data collected from the devices was protected and secured by Tyrion to generate a proof of all that information. So that's how this technology was built with traditional software stack, using our API to add blockchain-type proof and verification capabilities. So I didn't have to build something with a new technology stack with unfamiliar software tools. And so customers are using our technology in a wide variety of use cases. We have companies in healthcare, insurance, IoT data collection, a lot of audit and compliance use cases. We have partnerships with Deloitte and a few of the other big four consulting firms. And collection of pharmaceutical data to be able to verify that the information is accurate and has not been modified and was collected at a particular time. So you'll also notice that we put together a report based on the findings of us working with some of the world's largest healthcare and insurance companies for the past year. It's really a sober take on what's possible in blockchain today and what is the market opportunities and what some of the pitfalls are. So if you're a developer or you have a company who's interested in exploring our technology, you can sign up for a free account at Tyrion.com. It only takes a few seconds. And you can start to do things like proofs of concept and be able to build proof and verification capabilities that work on a global scale into your existing software applications. So thank you very much.
All right. Up next, we have DJ Chen, the founder and CEO of BitSE. Please give DJ a warm welcome.
Thank you. Good afternoon, everyone. Welcome to the Symphony Center. My name happens to be DJ, but today we're not talking about music. We're talking about healthcare and blockchain. Just a minute. All right. As you can see on the screen, so we're okay. Yes. Today I have brought the product VChain. VChain is a product produced by BitSC. BitSC is a blockchain technology company. Today we will show you something very new, and definitely it's built on the blockchain and disruptive technology. The basic idea is about the unique ID. You know, nowadays, most of the products are managed by the supply chain, different parties in the supply chain, including the manufacturer, the distributor, logistics, and the retail. For example, in healthcare, we have the pharmacies. But so far, most of the medicines, they are managed by each parties. But with VChain, we can make the unique ID globally. That means different parties in the supply chain, including the manufacturer, distributor, patients, pharmacies, and hospitals, they can interact with one product like this, the medicine. They can interact with the medicine closely, and they can interact with other party based on one unique ID, based on the product. That's how we put this on the blockchain. And all of the information will be displayed through a very easy mobile application. And in this solution, we have 4 modules. The first one is VChain anti-counterfeiting. That will help a lot to prevent the medicine counterfeit stuff like that. And the second module is VChain supply chain. We enabled the ownership transfer in this module so that different parties in the supply chain, they can manage the unique ID, and any party can check which party owns this product, owns this medicine. And even in the later on, you can see the patients, they have different prescription based on the different products, different medicines. And the third, we have the module VChain asset management. That's special designed for the logistics company and a forwarding company. For example, a lot of people, they will think currently the supply chain have different information. For example, the manufacturer, they have their own manufacturing information in their database. And the supply chain have the supply chain information. And for the pharmacies, they have their sales information. But all of those information will not be integrated in one system because there is no one can control all of the data. But on the blockchain, we have the opportunity to integrate all of the information together in one trusted database that will be reached by different parties. Of course, the privacy will be a problem, so that we will enable a private key to have different parties, have different authorities to input different data on this platform. And this platform will be controlled by nobody. And all of the data on the platform will be trusted. The fourth one is VChain client experience. We call it VChain client experience, but it's specially designed for the interaction between the parties on the supply chain, like the pharmacies, doctors, interact with the patients. For example, the patients will take some pills, but if they find some side effect, they find the medicine will get recalled, they need a channel to interact with the party involved in the supply chain. So we have this integrated in one application. We can also imagine with the unique ID on the blockchain, we can even have more application developed, like the first one, the device maintenance records. We have a lot of the medical care devices that's not maintained well, especially in the developing countries. But we can also record all of those data on the blockchain to make sure all of the devices are running well. And the second one, pharmaceutical tracking, I have talked about it. And the third one is medical billing. We can imagine someday when a doctor, they write some prescription, they can give you some medicine just with the handheld devices like the cell phone, put the cell phone close to the medicine, and all of those information will be checked. After that, your billing will be sent to your email automatically. How does it work? It's very simple. You see, this is the screenshot. I have bring the cell phone here. I can show you lively. This is the medicine I bought in the pharmacies here in the United States, but I made some slight changes. I put an NFC chip inside. The NFC chip is very small, just like a nickel size, rounded. We're also developing the second generation of the chipset. It's flexible. We can fold it, and waterproof. We can put it anywhere, like a medicine box, and we can even put it in maybe some maybe some liquid medicines, and we can just put this cell phone near your son. It's checking. It's checking. So you can check if it is genuine or not, and you can check the FDA certification online. You see, you got the picture of this medicine, and all of the information are listed down, and we can scroll up all of the information, prescription, and the detailed product description, and it will tell you how to take the pills. So that's the information integrated in one unique ID that will be stored on the blockchain. And you can also check the blockchain information below VeChain blockchain lively. That's the smart contract enabled on it, and that will be embedded in this application, and it will tell you which patients is gonna take this pill. So that will be a patient-centric medicine management system. Most of important, I think, many people might think how to tell the people, how to persuade the people it is the genuine one. Actually, we're working with PwC. They have assurance service called vTrust, based on the VeChain. There are, besides the technology, there are a lot of process risk can cause the fake one, can cause the fake medicine. But we get the support from the PwC. They have the assurance service. If you use the VeChain and together with vTrust service, they can mitigate all of the risk in the process, operation process, and guarantee there will be no fake medicine in your brand. So that would be one of the additional service provided to PwC. Okay, so this is my demo, VeChain Healthcare. Actually, we provided the chipset, NFC chipset, that will be more applicable to different scenarios. So we are looking for more partners to develop more applications based on that. We can make the healthcare process more transparent, and we can make the medicine track and the trace more transparent. That will be helpful to our health industry. Thank you.
Thank you, DJ. Up next, we have Matthew Spoke, the founder and CEO of Nuco, coming down from Toronto. Please give Matthew a warm welcome.
All right. Hi. We'll wait for this screen to turn on. So quick intro, my name is Matthew Spoke. Just flew in from Toronto yesterday. I have a relatively newly founded company called Nuco. We do enterprise infrastructure using primarily the Ethereum protocol. So how do you take Ethereum and turn it into an enterprise infrastructure? Obviously, there's applicability in a whole bunch of different industries. We've been putting a lot of focus into healthcare. So I'm going to demo something for you today that we built as kind of a simple proof of concept and prototype with our partners at Deloitte. So there's a team at Deloitte actually that I used to work with called Rubix. Ileana, I think, is in the room here somewhere. So if you have a chance to connect with either one of us, our teams kind of collaborated on this. This is our kind of take on how do you find applicability to blockchain technologies in the short term, things that could possibly really add value today that don't really require the gutting of existing infrastructure. So you'll notice this is, the way I like to put it is this kind of like an additive prototype that adds functionality to a process where this concept doesn't currently exist. Let's see if my slide's gonna come up. Am I doing something wrong? Worst case scenario, we'll all huddle around the stage and I'll turn my laptop around. Oh, there you go. Oh, it was there. So basically, I'll walk you through the concept while we're figuring out the screen. We're working on what we call, prescription fraud. So we identified kind of 3 areas where prescription fraud becomes a big issue, 3 opportunities for somebody to take advantage of the relatively inefficient way that prescriptions are issued by doctors and redeemed by pharmacists. So I'll walk you through kind of a simple process flow of these problem areas, but basically they get classified into 3 categories. One is prescription forgery, so the ability for somebody to change a already issued prescription by a doctor. 2 is a prescription double spend. We're kind of piggybacking off of the terminology of Bitcoin, but essentially the ability for me to use one prescription and go to multiple pharmacies and get that prescription redeemed for prescription drugs. And 3 is the idea of doctor shopping. So if I can go with the same symptoms to multiple doctors and get multiple prescriptions, and then, obviously, I don't have to tell you, but this leads to a problem around prescription drugs making their way into the black market. Okay, the color's not working great, but we will work with this. So this is just to give you an idea of, in the US alone, the size of this problem. So $3.75 billion on an annual basis spent on this prescription fraud problem. So it's an enormously expensive problem for the healthcare industry. Most recent estimates, I think, are as of 2015, had over 25,000 people dying in the US related to prescription overdoses of wrongfully issued prescriptions. So most of this has to do with prescription drugs being purchased in the black market. So I'm gonna walk you through, very simply, these are the 3 that I illustrated: prescription forgery, the prescription double spend, and doctor shopping. So if I walk in through these one by one very quickly, and then I'll jump into a simple live demo. This is our take on kind of a potential solution for how do you use the blockchain to issue a unique identity to not the individual receiving the prescription, but to the prescription itself. So how do you treat the prescription as if it was an asset changing hands, so that I could prove and use the similar concepts to how Bitcoin creates this concept of digital authenticity or digital uniqueness and apply that to a prescription. What we wanted to do in this process is we wanted to make sure that this was as seamless as possible with the way that prescriptions are issued. So if I imagine myself walking into a clinic with symptoms, I'd probably see that the process ends with me leaving with a piece of paper. And that piece of paper I will take to my pharmacy, and that piece of paper will lead to me receiving a prescription drug. So we wanted this process to work with that. I hope that when we move on from this slide into the live demo, there's something weird going on with the colors here. But so this is the prescription double spend problem. And then quickly, what we didn't end up building into the prototype, but what we're currently working on with Deloitte, is the third problem, which is the doctor shopping. So doctor shopping takes a little bit of a unique characteristic because then you do have to be able to identify to a certain extent with anonymized data who was the person actually going to get the prescription. So there's a slightly added complexity to the doctor shopping use case. But I'll start by showing you a demo for the first two, the forgery and the double spend. So let me get this screen blown up. Okay, the colors are working. So this is simply a live view of our blockchain network operating right now on, I think, 8 nodes around the world. And here is the use case. So we've laid it out relatively simply, split the screen in half. So if you can work with me for simplicity here and imagine that the left side of the screen is what the doctor would be interacting with, and the right side of the screen is what the pharmacist would be interacting with. So very simply, most doctors today, especially in the United States, are being regulated into having to do prescriptions through a computer system as opposed to writing them by hand. So the output here is you get a PDF document that gets spit out of this system. We're trying to, as little as possible, touch the infrastructure being used by that doctor's clinic. And as that PDF gets spit out, apply it into this interface so that you can add a unique identifier in the form of a QR code, re-enter certain little bits of information like the name of the drug, a unique identifying number that could be the health insurance plan, and the quantity of the drug being issued. So if I walk through that process and I say, I have a health card number, 1, 2, 3, 4, 5, 6, 7, 8, the name of the drug, and let's say we're going to give out 10 pills of this drug. And this is kind of an exact replication of what I might find in a very simple prescription document. So here's a simple sample of a prescription PDF. So if I take that PDF coming out of the doctor's system and drag it into this interface, what you'll notice is that it's essentially dragged it in. I'm going to submit the prescription to the blockchain. If everything works appropriately, which it never does when you're doing a live demo. Here, 1 second. Let me try that again. We're going to get a QR code that gets spit out. And then we're going to cheer when that happens because it'll have been a big success for the live demo. Okay, this is every presenter's dream. Give me 1 second here. Okay, so let's start this again. Prescription into the interface, submit prescription. Okay. So I'm going to skip a step here because something's obviously not working. Apologize for that. But if I go back to the prescription form, I had dragged it in. I create a unique QR code that then appears here. So this is my record of prescriptions being issued by this particular clinic, Dr. Chris. Dr. Chris is issuing these unique prescriptions. This QR code is in the form of it has 2 things categorized inside it. The smart contract sitting behind this QR code has the name of the drug, the quantity of the drug, and a hashed version of the PDF document that I upload into the system, okay? So once I take this QR code and I walk over to my pharmacy, essentially you can imagine that they have some sort of scanning device where they can scan the QR code to verify its legitimacy. So I scan the QR code at the pharmacy side. Let's try it here. Give me 1 second here, guys. Sorry about this. And what the pharmacist will be able to see is a version of this prescription that demonstrates, so there's my QR code. So now it's working the second time around. So what the pharmacy will be able to see when I drag this QR code in is the fact that the prescription document matches the numbers and the name of the drug that I inserted into the smart contract, so they can prove that there was no forgery that happened between the issuance of the prescription and its redemption. And then what the pharmacy will also be able to verify is that that prescription has never been used before, because we've essentially attached to it a unique characteristic on the blockchain. So if I take this QR code and drag it over into the pharmacist system, it'll say the name of the drug, the quantity, and it'll say ready to be dispensed. So it gives the pharmacist kind of a thumbs up, you should give this drug to this patient. Now when I click dispense the drugs get issued, and what now is happening is a transaction's being sent back to the same smart contract to essentially change the state of that contract from not dispensed to dispensed. So that if that same QR code were to go to another pharmacy across the street, after that transaction has hit the blockchain and they rescan the exact same QR code, they would not be allowed. It would give them an error message and say, this drug's already been dispensed. So assuming that the use case is gonna work well right now, I'm gonna go and scan a new prescription. You'll notice that these blocks take 10 to 15 seconds to propagate. So assuming that the block is now propagated, I take the exact same QR code and drag it in here, and the prescription has already been dispensed. So very, very simple example of where a blockchain can be used to identify something as unique as a prescription. So that's the simple demo that I wanted to walk you through. We're obviously looking at maturing this to a more full solution. We've got access to a great set of expertise with our partners at Deloitte and their healthcare practice and the Rubik's team. So we're gonna be maturing this to a kind of complete idea, including the doctor shopping functionality. And we're looking for partners to work with on this. So if you have any interest, please come find me, find Eliana. We'll be here mingling after. But anyways, that's all I wanted to show you today. I really appreciate the time. Thank you.
All right, thank you, Matthew. Up next, we have Ryan Singer, the CEO and co-founder of Blockchain Health Co. Let's give Ryan a round of applause.
Yep. Hey guys, just waiting for this to go, and then we'll get started. How's everyone doing today? It's getting deep into the program. All right. Hi guys, my company's called Blockchain Health, and we're working on using blockchain technologies and services from the blockchain network to secure clinical trials. So clinical trials need a better way to recruit patients, they need a better way to ensure and capture informed consent, and they need a better way to monitor and govern compliance with HIPAA and other regulations during the course of the trial. We'd like to help you with that. We've built our technology stack on top of the Bitcoin network, so we're actually consuming network services from Bitcoin to do these higher order things like identity management, consent management, and records custody. So you might ask, why Bitcoin? A lot of this actually Jeff went through in his presentation, Blockchain 101. But the Bitcoin network is a new global utility. It's an open network like the internet where anybody can initiate transactions and introduce them, and every peer gossips about transactions and blocks. And there's a lottery game that the players play to be able to order the transactions into blocks, creating what Satoshi called the first decentralized timestamp server. To make this more useful, for an eCash system, which is what he wanted to do for Bitcoin, he built in a public key infrastructure where you can register certificates as accounts in the Bitcoin blockchain, either singly or registering multiple certificates that have a relationship to each other. This is extremely useful for certificate authorities and other identity providers that would like to pin and register their certificates on the Bitcoin blockchain, either singly or in relation to each other. They're easy to register. You just spend a Bitcoin transaction, and they're very cost effective. Bitcoin transactions are currently 10 cents each. If you combine these two, that you have well-authenticated PKI authenticated transactions that spread throughout the network and get timestamped and notarized by the timestamp server, what you end up with is an extremely flexible, extremely cost-effective public notary service. You can register any fact, authenticated to particular identity services, with an unchangeable history and a central registry. These are the network services that we're consuming to improve clinical data management and clinical identity management. So for the identity service, we've been using the Bitcoin blockchain to track and credential and decredential devices. Devices are related to humans. So you have your mobile phone or your laptop or whatever. It's the goal of the phone or the laptop to tell the difference between you and someone else. It's the goal of the blockchain to be able to tell the difference between that phone and a different phone. So devices authenticate humans, devices are credentialed and decredentialed in the blockchain. We've created a clever mechanism where multiple trusted parties can coordinate to restore access, even though none of them can actually access on themselves, in case your house burns down with all of your devices. And we've designed the system so that this form of authentication can link directly to FHIR profiles and identify you to clinical solutions that use FHIR. Using that, we've built consent management technology where the patients can go through consent flows on their own device, just like if you've ever built apps using Apple's Research Kit, the same idea, where the patient goes through, they can read the fine text, or they can just look at the pictures for the particular things that call out, you need to know this, you need to think about this is how long you're going to be involved, stuff like that. And then when they get to the end of it, they're authenticated using the blockchain identity service and using their own device, and they place a legally binding e-signature under the e-sign act on that thing, on that document, and then that document and the fact that it was signed, that event is anchored using the chain point standard that's invented by Tyrion, who already presented, in the Bitcoin blockchain forever. So you can prove that that document signed by that person happened before that time, notarized by the Bitcoin blockchain. And you can never go back and destroy that proof. You can never go back and modify that proof. You can revoke those decisions later, but you can't change the fact that those decisions happened, which is pretty cool for consent management because normally the compliance organization is also involved with wanting the trial to work. So it's harder to make those kind of guarantees. And this product, the consent management product, white labeled mobile apps that'll communicate consent using FHIR messages directly using the consent and contract terms in FHIR. And so the database that you use to track all of these consent events can also be used to actually custody the clinical records themselves. It'll consume FHIR resources from their clinical sources, so those FHIR resources can be labs, they can be EMRs, they can be whatever, and then it'll cache them within the database that actually does all events anchored in the blockchain using Chainpoint. So, and all events anchored with regard to each other, so in order. So if you were to go in and delete an old event, then all of the events after that would fail their audit. So not only are you guaranteed to see everything that's happened to those resources, every access event, every search, every query, every edit, but you're also guaranteed that you have the complete set of them and that every single one of them was authenticated and identified. And this database is intended to actually track the permissions that came with consent. So if you're asking to do something with this data that's outside of the universal patient consent, say you'd like to share it with a third party or whatever, it can actually trigger consent flows to send the patient through a new consent process in their mobile app. So we're announcing today the opening of our private beta. We'd like to get your companies involved. We're currently working with Merck that built a proof of concept on top of our private beta, and they're currently doing the final stages of finalizing that and turning that in. And we'd like to work with more companies to do this. We'd like to work with pharmaceutical companies, CROs, and anybody who does investigative research with patients, so medical universities, things like that. And we're interested in hearing from you. Long-term vision is we'd like to get involved with the recruitment angle, helping the data flow for clinical data to actually identify particular patients globally, acquire targeted data directly from users, have the users go through the consent flow before they've been identified. When the user knows that you're looking and that they have the data, but you don't know that that user potentially qualifies. And have an ecosystem of apps like Fitbit or MyFitnessPal or labs or even pharmaceutical apps for the local drugstore, collecting and creating this health relevant data and using it to qualify and turn over potential patients that participate in your trial that have already consented to the sharing of the data that want to participate. So the long-term vision here really is no more aggregation of data per source or per institution, but instead aggregate data per study or per query. So when you want to do a study on diabetes, you send out a message to the entire world with your inclusion and your exclusion criteria and your consent flow and whatever compensation, if any, that you're offering and things like that. That data is evaluated where, that query is evaluated where the data is in relation to the patient on their own devices, at their own point of care, labs, wherever. And if the patient qualifies, they're sent through the consent flow. If the patient doesn't qualify, there's no reporting back. So there's no leakage of information at all, not even de-identified aggregated information, except for the patients that have already consented to want to try and participate in the study or trial. And so we anticipate this whole process will take hours or weeks at longest to go from sending a query out into the world to having a fully formed global set of people who all they have in common is they fit your inclusion-exclusion criteria for purpose in that study, and they agreed to share their records with you. In terms of the market size, this is always something I show just in case VCs are in the audience. So healthcare is the whole $5 trillion pie, right? But contract research is more like $25 billion a year. That's not actually the clinical treatment involved with the research or the sponsorship of the research or the investigation. It's just the management of the process. Recruiting patients and sites, managing consent and compliance flows, enforcing guidelines related to data handling. And we think that we can help improve that process by partnering with these guys. Our product's named EID, and we think it'll facilitate a more direct relationship between patients and researchers, dramatically reducing costs and improving science. We don't actually have a demo. All we've got are the deck, but if you're interested in joining our private beta, I can come to your office and do a demo.
Thank you, Ryan. For those of you that don't know, that was the first time that Ryan has talked about that publicly. So have super high hopes for a blockchain health company and excited to see how this project progresses. Next up, we have a demo of the GEM platform that Micah described earlier in his keynote. Presenting that demo will be Jeff Shelton, the head of product for GEM. Please give him a round of applause.
How's it going, guys? So as Tyler said, thank you, Tyler. This is a continuation of the conversation that Micah had with you guys during the keynote. We at GEM, we're here to illustrate GEMOS and actually show you 4 different GEMOS instances talking to each other in a healthcare context via this demonstration. So again, that's the data, the identity, the network, and the logic layer that sits on top, which is the core to our platform. So talking about 2 different types of transactions relative to the healthcare continuum right now. So this is the transference of HIE information as well as the revenue reconciliation of claims, which we spoke about earlier. So to kick off this demo, we have Jessica Perez. She has her own patient portal that's powered by GEMOS. So this is one GEMOS instance with a patient at the center of this process who has access to the entirety of their medical visits and HIE and PII information. So if we look at this portal, we have visits, we have her doctors, medication, personal information, everything around the necessary information to provide her care. So let's jump over. Let's go to a provider portal. And here we have our patient screen. We can scroll down, as you saw flash. That's Jessica Perez. And we basically can see this record by virtue of Jessica living within a patient identity registry that lives on the blockchain. So let's jump in to see Jessica. So here we're illustrating that we know and we have reference to Jessica herself, but we don't have the information about her doctors, her medication, her visits. And that necessitates a handshake between the provider and herself. So let's go ahead and do that. So I'm going to request access. This is a GEMLogic element that sits on this GEMOS instance, which essentially is going through gateway, going to network, propagating out executable code on the blockchain and having the validators within the network validate that transaction and that request for Jessica's information. So I'm going to select request and jump over, and we can see that this propagates over to Jessica's patient portal. So I'm going to allow access. I'm at the doctor's office. Why not? And as we click allow, we can see now that that information propagates over from Jessica's portal over to this provider. So I can see again the medication, visits information, patient summary, everything now to provide better care for her because I have more information than I did previously than when she came in. So Jessica's there. She has abdominal discomfort. So let's create a visit and add that to her record. So here we see top-level patient information, the reason to which she's there, examination details. This is a really simplistic view of what could be here. We're not healthcare professionals, so this is our illustration of the transference of that record. But here, this could be labs. This could be IoT information. This could be imaging, anything relative to a single episode of care. So let's go ahead and save this. We can see that now this visit is related to Jessica in the provider's application, and it's automatically propagated over via the blockchain to the patient portal. So essentially what we have is Jessica has an observer who is looking for transactions that are validated by the network, to which then she can then see information about her and that visit. So the very critical thing to point out here is this data never leaves this application. So this provider, and by virtue of GemOS and GemData, has the ability to connect their own S3 buckets, if you want to get crazy IPFS, NoSQL databases, where this content lives. What we're really doing is, via the blockchain, providing a pointer to that data store for that application to then query that information. So let's add a little complexity to this. So I'm going to introduce a specialist provider. So let's say that Jessica is on vacation. She lives in California. She's going to Paris. What's the best way to be able to gain access to her medical information overseas? This could also be illustrated by being just down the street. So we're gonna take that same process to create that handshake with this application, such as we did with the previous primary care application. So again, we go to our Patients tab. We find Jessica Perez. And again, we're in the same state. We have not made that handshake and committed the access provisioning to documents relative to her for this provider yet. So let's do that again. Send that request. Now we see this propagate similar to the primary care provider. So I'm going to allow this. And then here we go. Here again, we have this information flow over. So I'm going to continue with her care. I'm going to add a new visit. She's having the same level of discomfort. Let's go ahead and create a new visit. We could then see this flow into this application. We then see it go into her application, as well as the provider's application. So now we have this triangulation effect. All of these GemOS instances that are validating transactions on the blockchain now also have the permissions to the data that lives in the respective data stores of the various providers, but all relative to that patient ID that lives on that registry of the blockchain. So again, data security, data ownership still lives with the companies who created that record. We're just having the ability to share that record around the network conditionally based on who needs access to provide better care. So that's not really where we end, though. So as Micah talked, or spoke rather, we're working on the data transference, or the transference rather, of different data types across the network. So it's not just about two parties transacting between the same medical visit information. We're adding claims to this via revenue reconciliation. So I can go into this visit, and now I can create a claim. Let's get this provider paid. So by creating a claim, I'm now selecting a payer via the payer registry that also lives on this blockchain. I'm going to confirm this patient. And then here I can add my diagnosis coding. So forgive me if this is not the most sense in terms of matching diagnosis and procedure codes, but you get the point of this illustration. So what we're doing here is we are creating a new document, a medical claim. What we're also doing is allowing for that payer to be able to set the rules of how to be in business and send medical claims for that reconciliation process. So not only are we able to transmit information and permissions on the blockchain, we're also able to propagate rules out and have those as the standard for all the participants in this network. So by virtue of clicking next, I'm going to be sending this claim over to a payer that we're introducing. And here we see this recent claim that's flowed over from that application. So by doing that, what we did is we were able to say Dr. Deborah West submitted this claim over to the payer with edit rights. So basically what we're going to do here is we're going to append payment information to this record and then be able to propagate that status back to that originating provider. So I'm going to create that payment. I'm going to select the claims that are relative to that provider that need payment. This could be a single claim. This could be bulk, a batch of claims that are similar to an EDI 820 as well. So after I select next, I'm going to confirm. And now when I go over to the provider, I see now that payment. So the real value here, and this is really kind of the thought leadership that we've done at GEM, is to isolate those areas of opportunity within the industry that we know that we can very seamlessly help and bring parties together within a network to solve amongst each other. So, this is typically a process that Mike had mentioned takes upwards of 4 months. It could be something where there's a clearinghouse that sits in the middle that does that kind of adjudication process, all of the coding. There's a back and forth if there's errors. And that ultimately leads to the decreasing percent of payment conversion for those claims by that payer. So, we could kind of look at the ultimate goal here of being able to say, as soon as a back office employee inputs these codes into the system, we could have rules that say, if diagnosis code X and payment under Y, automatically pay that. But we could get to a potential system where we have the ability to not just collect the copay here in this office, but also collect the patient responsibility, because we know via this network exactly how much that patient needs to pay to close out that claim. So here again, we have that payment that came over. We're going to collect the remaining balance. And then we're going to close out that claim. So we've isolated that we have, or showcased that we have 4 different GEMOS platforms. They're dealing with 2 data types, 4 actors, and their processes are connected. They're also orthogonal to each other. And we're having this network validate all of the transactions, all done via GEMOS, which we talked about. And the real core purpose of GEM is to bring these companies together and really build meaningful applications. This is the example of we saw opportunities, so we built it. And we're here to do that in many, many other spaces relative to healthcare as well. So thank you guys for your time.
Thanks a lot, Jeff. All right. Last but certainly not least, we've got a special team to bring out here. For those of you who don't know, this past weekend we held a 24-hour blockchain hackathon as part of this week's events, and we had a great turnout. We had 18 different teams present projects using the blockchain in some novel way, ranging from everything from revolving loans funds to insurance to reinsurance to medical records to emergency responders. Huge wide range of things and a great turnout of some very qualified and professional developers. Out of those 18 teams, the judges deliberated and picked 5 to award over $30,000 in prizes to, thanks to our amazing sponsors for the hackathon, State Farm, GEM, Evu Digital Labs, Tyrion, and Bitfinity. But we only have time for one today, but we wanted to bring the winning hackathon team out here and let them show you what they built in just 24 hours. So please welcome Team Verifarm.
All right, so we are Team Verifarm, and we were the grand prize winners of the hackathon. My name is James Poole, and I am a software engineer. I'm the guy that hides in the basement and bangs out the code.
My name is Morgan Cron. I'm from San Diego Biotech Beach, and where we brought you Salk and Illumina, and I help small pharma and translational research labs bring their ideas and ramp up and turn them into drugs.
And I'm Jason Kronk. I'm a licensed attorney. I also have a 20-year background in IT, and I have a startup doing auditable digital tokens in a related space.
Hello, I'm Michael Tidwell. I'm a software developer. I work at Liaison Technologies. I do the cool stuff on the centralized side, like with distributed systems and then your Apache X software. I run the Atlanta blockchain, which is a meetup group, and that's in Atlanta. We have about 300 members, and we have a lot of cool people present.
And we had one other team member who's a local guy, and he was the one that did the graphics, so if it looks good, it's all his doings. So if you don't know what a hackathon is, or don't really know how it works, so 3 of us came from Atlanta, myself, Jason, and Michael, and basically what you do is you start, and they let people present ideas. People can stand up and say what they're interested in doing or what their skills are, and basically they say go. Everybody forms teams, and you try to build something in 24 hours and be able to present it, demo it in under 3 minutes after 24 hours completes. So we had a couple ideas, and the 3 of us got up, and Jason told everybody what we were thinking about doing, and we pulled in Morgan and our other team member, Austin. And we worked on the code. We figured out the idea, the problem we wanted to solve, and we worked late into the night. We tried to go to the hotel at 4 o'clock in the morning, but they had given away our room. So we slept in the car for a couple hours, and then went back at it for the rest of the time until the time limit was up after 24 hours. So, it was a great time. We all had a lot of fun and met a lot of people and learned a lot of stuff. So without that, let's go ahead and show you guys what we did.
Well, first off, I like to share just my experience. I'm very new to blockchain. In fact, I first heard of blockchain at the distributed conference in St. Louis in April, and was inspired by Jem and talking to Micah and Emily. I was like, oh, you guys are so amazing. I was like, this is really fantastic at what you're doing. But I knew nothing. And so I went back to my classmates and asked them, oh, I would like to do something like this in pharma. How could I do that? And they said, oh, you can't. There's tons of people already doing it. In fact, this one big company has deployed like 100 blockchain developers in Ireland, and so there's no way you can do that. I'm like, well, and they're just going to start their own company. I was like, oh, okay, well, fine. But it's still, I couldn't get it out of my mind. I just kept thinking about it and reading magazines and just thinking about what can we do. This could really help us in our industry. And listening to Ileana, I don't know if she's here anymore, but I was just really inspired by these people at GEM and in the conference. And I just signed up, really, just like a few days ago before the hackathon, because other people were saying, oh, whatever you need to know about blockchain, you already know, you don't need to go. Well, I'm going anyway. So I went, and I was afraid that no one was going to play with me, because I wasn't a developer. And at Biotech Beach, we have this thing, the perfect place to play is, the sand is like close to the water and then yet further back. And so we make these sand castles where you can still, get to the water, and then, but not too far back, and then the tide will come in and take away your sand castle and everything. And but everyone gets to share their tools, and I really like that sandbox analogy of sharing tools and just making something fun, and that's what I got out of the hackathon, was just making something fun. And I'm going to turn it over. These guys are like, you're going on. Show you what we found. So what we made, with these guys made in 24 hours.
Let's do it.
Okay.
All right.
There it is.
You're going to go ahead.
You want to start off?
Yeah,
that's it.
No, we do our pitch like we did yesterday.
Okay,
Pharmaceutical provenance.
okay, so
Verifarm.
Verifarm is pharmaceutical provenance. That's just tracking a drug through the supply chain. So from the raw materials all the way down to the API. In our world, that's active pharmaceutical ingredient, the API manufacturer to the drug manufacturer to the pharmacies and hospitals, to the doctors down to the patients. So some of you may be aware of the recent FDA Drug Supply Chain Security Act that has to be implemented by 2023, and all companies all companies along the supply chain, from the manufacturer down to the consumer, must must prove their identity and where their drugs were made and where they came from, all the way down. And so that's what Veripharm.
So why is drug tracing important? So the industry loses about $200 billion a year by one estimate due to counterfeiting of drugs, that is drugs that are illegitimately made entering the supply chain. On the other side, diversion of legitimate drugs to the black market costs an estimated $72 billion a year. And then finally, drug tracing is important because you need to be able to track if there's a problem at a consumer level, to track it back and find out where contaminated drugs entered the supply chain in order to do appropriate recall. Now, what was our solution? It was to log the transaction data, or just put a log of the data into the blockchain. And how we did that was we take the three required documents, 3 transaction required documents that must accompany all drug transfers. We digitally sign those. We go through Tyrion, who you heard from earlier, and then load those they are loaded by them into the Bitcoin blockchain. Now, what does the blockchain do for us? The blockchain ensures integrity in the audit trail. So the signature authenticates the documents, so we know they haven't been tampered with, and then the blockchain timestamps it, so we know the signatures weren't applied retroactively. So now Michael and James are going to go through a demo for you of what we were able to create in our caffeine-fueled 24 hours.
Yeah, we can actually show you the login page works now. We have enough time. We're kind of rushed with the initial meetup, but yeah, we made an awesome website, and this goes over the whole supply chain. So from the raw materials, like what we're saying, traceability and auditability, all the way to the hands of the consumer, and you're able to go over what Kronk was saying about counterfeit. You can make sure things aren't getting diverted, and also like counterfeit, diversion, and recall. So now you can easily, if there's something that's found in the manufacturer side, you can also have that traceability that's kind of inherently available when you're using stuff like blockchain to kind of trace back and understand who, or trace forward and trace back who has what. So on this view, we logged in as a manufacturer. So right here, Mandy, and we see all the things that we receive from the API, which is active pharmaceutical ingredients. And then here's all the outputs that we've had in the past. And then we can show how we can transfer something to a wholesaler. So we can pick our products that we're doing and give it a name. Yeah, 21. And put in some information about a lot number. Say we've done all this stuff, compliance with the law. All right, so right here, that got added. So we can look at one of these old transactions that we put in, and we see that the 3 documents check out. So we're making a lot of API calls to Tyrion when we're all doing this. This one checks out. We made a fraudulent one for an example, a Zocor example. This one doesn't check out. This one was like fraudulently put in. Someone tried to. Here, we'll open it up. So this one is a conflicting lot number. So lot numbers are like it's the terminology used when. Do you want to explain what a lot number is?
I think they know.
Yeah, I think they know.
Okay. Y'all know what lot numbers is. I learned a lot about the medical, pharmaceutical, this whole area. But essentially, someone tried to copy a lot number. The hashes that were made down here don't mesh with the ones that were put previously because they're timestamped. And then you have we have information about the blockchain receipt, and then the SHA-256 hashes. So if you're trying to troubleshoot this with somebody, we have all the information right there for you.
And I could imagine, I mean, this is what we put together for hackathon purposes, but you could imagine that in a real world situation, people might have handheld devices to scan in lot numbers via barcode, to make the process a lot more automated. So do you want to?
I would also like to say we're really happy that Tyrion was available because
it made it easy.
Using the blockchain in a 24-hour period is actually, especially if you don't have like a lot of experience, is a pretty good task on its own. So the fact that we had Tyrion available, and I think that's why so many people used it, is because it's actually, if you only have 24 hours and you've never really worked with Ethereum or you never really did some low-level stuff with Bitcoin blockchain, then it's kind of time consuming. So.
Want to pull up the next step slide?
Sure. So let's go back to the
So we didn't get to this in our 3-minute pitch at the hackathon, but we thought of what could be some next steps. One would be a fully decentralized version for increased confidentiality and availability. Right now, the way we designed it in the simple method is we have copies of all the transaction statements. Well, that makes us rife for a hacking target. It also makes us know individual players in the industries, know what kind of volume they're doing, which may be proprietary. They may not want people to know that. Putting it in a confidential way in a blockchain makes it more confidential because, again, a single player doesn't have it. And finally, it makes it more available because you're not relying on us. It's a decentralized availability. Add proof of burn for destroyed or consumed drugs. So what happens when you have a lot that goes bad? You don't want to keep that as just kind of an open thing in the transaction ledger showing that you've got 1,000 pills and really you don't. So you need to have some way of proving that you've destroyed those and keeping an audit trail of that in there. Auditable prescription capabilities. So we want to tie in something on the consumer side so they can present a prescription and be able to take possession of the drugs and then have that auditable in our system as well. And then finally, once we had a real working pilot, maybe identify a really highly scrutinized prescription drug like methadone that might serve beneficial for this. So I think that's it.
That's it.
Thank you.
Thank you.
Thank you, Team Verifarm. We held a similar hackathon in St. Louis this past summer, and the winning team from that hackathon just raised their first round of venture funding. So we have high hopes for Verifarm. Next up, we've got a short break. I know it's been a long day, and I am definitely in need of some coffee. So get up, stretch your legs. We've got some drinks and snacks out. The next set of panels will start at 4 o'clock. We have interoperability in this room. We have supply chains and counterfeiting in the Mike Curb room. And then we have empowering consumers up in the balcony lobby. We'll see you guys at 4 o'clock.